couple of clarifying questions, Tom, that came up during your presentation. Just a couple of things here. What kind of stroke are you talking about? Clot or vein rupture, or what kind of strokes are these?
We didn't we didn't differentiate between the two. That was just total stroke rate in the country or in the state.
So that might be one potential way to parse the data a little bit finer. And then, to your knowledge, are there any demographic correlations, such as with race, socioeconomic status?
The stroke belt do not explain the stroke belt phenomenon.
Okay. All right. Well, those were some clarifying things that just came up real quick. Dr. Burgess and Dr. Richter, and not just you, but several times during the day, we've seen the idea that soil, sort of thinking about soil as a source of hazards, of contamination, or what have you. The flip side of that, and one that is perhaps more familiar with the community of people who work in soil health on a regular basis, is more along the idea of soil health management as a way to get some benefits in the environment, such as improved water quality, mitigating climate change, filtering contamination, increasing drought resilience, and so forth. So going back to the idea of diesel fuel and lead in soil, other kinds of contaminants and hazards we've heard about today, what do you tell us what your thinking is on the role of soil health management to actually deal with those as a mechanism, as a way to try to help mitigate those?
So I remember Keith Nachman addressed this point, and it seems to me we can walk and chew gum at the same time. We are a soil disturbing agent. That's what we do. We break the ground. We use the shovel. We use the plow. But we also have to think of ourselves as soil forming agents. And I remember Keeve made a comment about this issue and how important it was to urban farming, which is just one example of the public education we should be doing a lot more effectively, that we need to develop. We absolutely need to develop a positive relationship with the earth.
You asked me a soil scientist question, but I want to. We've got to know is how much can the soil handle? How much of things like I've done a lot of aspects from environmental health and looking at things like wastewater management and landfills and stuff like that. And we need to know this particular soil under these conditions, how much can it take? How much can it remediate for us? How can we increase that ability of the soil to handle the bad things we're putting into it? That's all.
Okay.
Because it is really remarkable what the soil can handle often. I'm not talking about a sandy soil, but I'm talking about a complex soil of sand, silt, and clay with organic matter. It's really taken the burden of the human being for so long and done it well in a lot of places. But on the other hand, we have the South Carolinas. Thank you, David Montgomery, to point out the southern Piedmont. It was a breadbasket for the nation, he said. And now you go there and it is practically the most eroded former agricultural region in America.
I've been to a lot of environmental health meetings like where they talk about this stuff, and they've always talked about the air quality and the air pollution and the water quality, and I've never heard a talk on the soil pollution.
Interesting. Let's go back, Linda, to the idea of risk assessment a little bit, and this, a lot of the people in this audience may not be familiar with some of the programs that USDA has to promote on-farm conservation. That's a big investment on the part of the taxpayers through USDA. When you think about the risk assessments that law requires for some of those programs, where does soil and soil health fit into that? Is it that soil represents a source of hazards in those risk assessments, or Is it a risk assessment to look at reduction in environmental hazards and improvement? And how can we communicate in all of that? That's a lot. So in 90 seconds or less, no. I mean, where does soil health fit into the risk assessments that are associated with those, that are required for those programs? Is it they're a source of hazards and that we want to mitigate that, or is it a source of benefits that will help reduce risks to natural resources?
Now, are you talking about the soil itself being a hazard? I would think the risk assessments, and you're really only talking about one risk assessment because there haven't been multiple ones, which would have looked at soil quality and
what was that? What was that associated with?
soil quality.
Yeah.
Well, it was associated with various conservation practices. So the practices were put in place to increase soil quality. But we don't have the risk assessment that you think we have. We do not have a quantitative risk assessment that looks at all of the impacts of conservation strategies.
I'm shocked.
That I'm aware of.
So when you do these USDA, these risk assessments within USDA that are required for some programs, and you talk, listen, I'm shifting gears on you now before I go back to that, and you talk about human health, reduction of risks to human health through some of the USDA's programs, and you had a big long list of things on your slide about things that you could use as ways to try to look at human health, because there isn't one number that you can get, or a human health-o-meter. Which ones of those are really important in those risk assessments?
Okay, I'm translating your question into which of the measurement endpoints that you could measure might have some utility in telling us something about human health.
Okay, you can translate it that way.
That's how I'm translating it.
That's fine.
But I'm also going to say you have an assumption that there are lots of risk assessments, which I'm going to disabuse you of in the human health field, because primarily I only have one agency that has human health risk assessments, and there I'd be looking at pathogens in food.
So that's FSI, Food
Yes,
Safety
the
Inspection
Food Safety Inspection Service. I'd be
Okay.
looking at food safety issues. You see, the statute that you're referring to is very program-specific. It's regulation-specific. So you would not be doing risk assessments in general. You would be doing risk assessments for proposed regulations that have more than $100 million of economic impact, as measured in 1994 dollars. So that's not a lot of
That's a lot of programs.
Right.
So here's my point. Like a good lawyer.
I knew we were getting to something.
Like a good lawyer, I knew the answers to the questions that I was asking, and Linda's also an attorney, so she can identify with that. The point is that as a framework you proposed, there's a lot of conceptual meat there for us to organize our thinking around, but we don't have a lot of precedent for having done that.
There are not a lot of examples,
Yeah.
if that's what you're getting
Yeah.
at. But I think that the framework is a viable framework, and I think you could link both the human health or public health attributes to soil health, which is also somewhat nebulous. But you'd have to do it carefully because you'd have to have it within the context of a specific question.
Right. But this could help us identify gaps of data. What kind of information, measurements, data would we need if we wanted to undertake such a thing? It would help us say, oh my gosh, we don't have these kinds of data. And in the long run, it may also help us get to improvements in some of the programs that we would be looking at in the process.
Yeah, I think you could, now the risk assessors in the room are probably going to be upset with this comment, but I think you could get a lot of bang for the buck by just going through the problem formulation step in risk assessment, which is the very beginning of risk assessment.
Mm-hmm. So let's start there.
I would start there and see what develops.
Okay. All right. Thanks. We're out of time for this panel, so I want to thank them and for bringing this particular perspective. Thank you very much.